Welcome to the Dog Advisory Council, a trusted resource for dog owners and enthusiasts. Today we will be talking about what to do if your dog stepped on a nail. An injury from a nail is called a puncture. As a dog owner, the first step is to evaluate the wound because you need to determine the severity of it. If the nail is deep stuck on your dog's paw, then you should immediately take your dog to the vet to have it x-rayed and cleaned. If you find just a small scratch and you are considering treating your dog's paw yourself, follow these quick steps. Wash your hands using soap. If your dog's wound is bleeding, apply pressure with a towel or gauze. Clean the wound of dirt and other debris with running warm clear water, but don't use soap. Inspect, and if there's still debris on it, clean a pair of tweezers with isopropyl alcohol and remove the dirt. If the cut is bigger than 1/4 inch long or it is bleeding non-stop, you must go see a vet because your dog may need stitches, and also antibiotics. Else, clean the wound daily and keep it dry. You can use an old clean sock to protect your dog's paw until the wound is completely healed. You need to look for signs of infection. If the wound isn't healing and it is swelling or your dog has a fever, he needs to see a doctor. If your dog has stepped on a nail, the first thing to do is to look for signs of injury, bruise, or discomfort. As mentioned earlier, the harm might not be deep or visible if your dog merely scratched its paws and walked away. However, this doesn't mean there isn't any damage done. So if you can't find any physical injury, check for signs of bruises or discomfort. Here is how to check for signs of hurt and pain. Wash your hand with soap and water for at least 20 seconds before handling the dog to prevent germs from entering the wound. Take the dog to a quiet place, pet, muzzle, or try to reassure the dog before handling the area. If need be, you can restrain the dog or ask someone to help hold the dog while you check the area. Gently raise the paws to examine the area. Specifically, check for signs of injury, bruises, and bleeding. If there are no physical signs, you can gently touch the area to ensure there is no damage. Also, check to see if the nail is lodged in the paws. Sometimes, the nail or pieces of it might still be embedded in the paw. Evaluating the damage. Once you've found the problem, you have to evaluate the injury. Some of the things to look out for here include: is there bleeding? If yes, how much? Is the injury deep? Is the paw swollen or torn? Evaluating the damage can help you know if you should go to a doctor immediately or you can treat your dog at home. If the nail isn't lodged in the paw and the injury isn't deep, you can first aid as a first response and visit the vet later. If it's a minor injury or you can't get to the vet immediately, you have to follow these steps to treat the puncture wound. If there's any bleeding, apply pressure with a clean cloth or sterilized gauze until it stops. Most experts agree to keep the pressure on the area for 10 to 15 minutes. Clean the area with a sterilized and clean towel or cloth or rinse under clean, warm water for few minutes. Dry the area with a clean towel and pat dry. If you have in your first aid kit, you can apply neosporin or polysporin to prevent infections and promote healing. Wrap the area with a sterile bandage to protect the injury from further harm and prevent dirt and germ from entering the puncture. You should be careful while wrapping the dressing so you don't restrict blood flow. It's advisable to add layers of cotton gauze first and then use a dressing square bandage because it ensures there is enough blood flow and prevents the cotton gauze from getting dirty. Clean and change dressing at least once daily. Reduce pressure on the leg for the next few days to allow the paw to heal and watch for signs of any infections. Visit the vet for more examinations as soon as possible. The doctor might also prescribe some antibiotics to prevent infections. You should visit the vet if the puncture wound won't stop bleeding after 5 to 10 minutes. If the puncture wound is dirty or has something embedded in it. If the wound is deep. When there are no improvements after 2 days of taking first aid action. When there are signs of infections. Puncture wounds usually don't require any stitches. However, in some rare cases, your dog might require stitches to treat an injury from a nail. It is always better for the vet to determine if your dog will require stitches or not, but you can easily tell from the following. If the nail is lodged deep within the paws. If pieces of the nail are embedded in the wound, in such cases, the vet will need to explore the area and remove the parts surgically. If the injury doesn't stop bleeding. If the puncture is very deep. Can dogs get tetanus from stepping on a rusty nail? Studies show it is rare for a dog to get tetanus. This is because dogs have low susceptibility to tetanus compared to humans and livestock. So, it is unlikely that your dog will get tetanus from stepping on a rusty nail if you treat it well. In fact, your dog is more likely to get a tetanus infection from foxtails than from a puncture, according to a study done at UC Davis School of Veterinary Medicine. The study examined 35 cases of tetanus in dogs and found that up to 50% of the cases were likely a case of a foxtail tract, and 27% were confirmed cases of a foxtail tract. Although your dog might not get tetanus from a nail puncture, however, it's not entirely unlikely. It's better to let the vet determine the possibility. If you want to learn about the signs of infection on dogs, and how to take care of a puncture injury on a dog, click the link in the description below. If the information in this video was useful, please like it and don't forget to subscribe.